Hi, teammates. Welcome to The Well, the Live Well podcast, the podcast that connects you to all the topics to meet you along your well-being journey. I'm one of your hosts, Jen Collins.
And I'm Seth Christopher. Welcome to The Well.
Hello, teammates, and welcome to The Well. Seth, it's been a pretty busy month of May here at The Well.
May is always a busy month. We're trying to get ready for the summer, but especially this month, we focused a lot on just overall mental health and well-being, focusing on resources. So really looking forward to today's conversation as well. New things here at The Well. We've got a new intro with music, maybe teammates noticed. We've also added a new co-host to one of our shows each month, Cindy Patterson. And then today's show, we've got a really great guest. Greg Hathaway is going to join us to talk about some of his experiences with spiritual care and education around Atrium Health system.
Those are all fabulous things. We really shook things up this month a little bit with our new music and our co-host. Since you brought up Greg, our conversation with him is so dynamic. What do you say we go straight into the interview and let him do our facts and talk about our topic today?
Yeah, today's topic is something I think teammates are really going to benefit from, just hearing it straight from Greg. So let's go ahead and jump into the interview, and we'll do a recap at the end.
Great.
Greg has been with Atrium Health since 2007 and is currently the Director of Operations for Spiritual Care and Education at Atrium Health's Carolinas Medical Center. He is also a proud member of the Atrium Health Code Lavender strategy team. Greg is a board-certified chaplain with the Association of Professional Chaplains. He is also a faculty member of Atrium Health's Clinical Pastoral Education Center and is nationally certified to teach clinical pastoral education to persons interested in developing effective spiritual care skills. He lives in Gastonia and is the proud father of 2 teenage boys. He enjoys playing music, meditation, breathwork, and running. Greg, welcome to The Well.
Thanks so much, Seth. It's great to be here.
We are tackling this month, Mental Health Month, and taking care of yourself. That's what we're talking about for the month of May. That's what our focus is here at Live Well, and we're so honored to have you as part of the Well. Let's tell us a little bit about. We did a wonderful bio. Tell us a little bit about what you do here at Atrium.
Yeah. As Seth mentioned, I've been with Atrium since 2007. And it doesn't seem like it's been that many years. And the longer I'm with the system, in some ways, the smaller the system seems to get, even though we are growing. And I've had the wonderful opportunity to work at multiple sites within the Charlotte metro area, anyway, of Atrium. And through most of that time, I have been either a manager of spiritual care department, as well as a faculty member of the clinical pastoral education program that Seth mentioned in the introduction. I actually started with Atrium as a chaplain resident myself. It's where I did a good bulk of my training. And these days, a large part of what I do is really helping to manage the operations of the spiritual care department that's here at CMC, on the CMC campus, which includes Levine Children's Hospital as well. And then, as Seth also mentioned, more and more these days, I've been involved in the work of Atrium Health Code Lavender more formally over the last 2 or 3 years. But even prior to that, I was beginning to be more involved and think about how to support teammates who are experiencing the distress that just naturally comes with the kind of work that we're involved in. And so that has been a growing part of my job responsibilities over the probably say the last 5 or 6 years. and that has taken on new focus as I've been involved in Atrium Health Code Lavender. But it's a great place to work, and every day is different. No 2 days are exactly the same, which I like.
Greg, I agree with you there. It is a great place to work, and I think we all can attest that, especially these days, but in normal times, there is no day that is like another. So the part of the exciting part about being Atrium Health, but from your perspective, you do some really important things. We have a natural partnership and sort of a synergy, if you will,
Yes.
and looking to take care of our teammates. And
Yes.
you mentioned that you're a big part of the strategy that goes across the system for Code Lavender. For teammates that might not be familiar with Code Lavender or maybe looking for more information, what exactly is Code Lavender?
Yeah, sure. Well, Code Lavender, the name itself is not new to us at Atrium. This was actually started by the Cleveland Clinic, I think going back to 2008. They developed Code Lavender to really be a rapid response to help staff deal with excessive stress. And they created that program really with that primary focus. And as word about that program spread nationally, healthcare systems around the country began similar kinds of initiative. I think here at Atrium Health, we had been, and again, this goes back a few years, we had been looking at a variety of models and chose to focus our efforts on helping teammates combat compassion fatigue, burnout, moral injury. And about 3 years ago, we partnered with some lean methodology experts that were part of Performance Excellence to create a very deliberate Atrium Health Code Lavender methodology and process. And so my elevator speech for Code Lavender, if someone asks, well, what is Code Lavender? I say it's a systemic or a systematized response in service to teammates' well-being. That's a very kind of quick way to think about it. So that includes, of course, addressing and responding to specific incidences and events of teammate distress. And just as we would call a code blue, for example, when someone's heart has stopped and that individual might need CPR, we in our system can call a code lavender when maybe a teammate's heart and mind have somehow been negatively impacted, either by a personal crisis or a professional crisis, and that teammate or group of teammates needs a compassionate response. So that response aspect is a big part of it. But what's been very exciting to me is to also plan and implement ways where Code Lavender is also about building a culture of compassion, which then includes, of course, preventative kinds of interventions and modalities. And that's where some of our compassion champions and compassion catalysts can come in. So it's sort of become, in some ways, it's become an umbrella term that includes lots of different things. Yes, it's about responding to teammates in need, but it's also about how do we, on the preventative side, how do we help to build a culture of compassion among teammates?
It's so much to take in. It's just a beautiful thing y'all are doing, honestly. I want to back up just for a second and touch on something that you mentioned, this compassion fatigue. I want to dig into that just a little bit for teammates who, I think sometimes when we hear about compassion, we know healthcare workers, they have it, right? That's why they go into healthcare. And I think it's hard for people to think that that can become burdensome and tiring. Yes. And, day after day, patient after patient, that something might happen that could tax your compassion. So that term compassion fatigue, what have y'all just briefly, if you could talk a little bit about that to kind of educate our teammates listening who may not know.
Yeah, absolutely, Jennifer. I love the question. I could talk about this all day, really. One definition, and there are multiple definitions of compassion fatigue over the last, I'd say, 20 or 30 years. It's gained a lot of attention. And it actually started, if I'm not mistaken, that term came out of therapists and other helping providers working with veterans who were coming back from war. There was the sort of the recognition of post-traumatic stress. Of course, in many ways, that's a very, very different setting and context than we're involved in. But there was and this may be more history than you need, but there was an academic who was studying that by the name of Dr. Charles Figley. He's considered in many circles kind of the father of this term compassion fatigue, but he was a counselor, a therapist who was listening to veterans who were talking about their experiences on the battlefield. And he would listen to their stories all day, and then he would go home, and he started to realize that he was experiencing some symptoms that he couldn't quite track. Like, why am I feeling overly tired? Why am I feeling stressed? Why are these stories of these veterans kind of ruminating? I find myself ruminating on these. And what he discovered was what some now call secondary trauma. He was being traumatized, not directly because he wasn't on the battlefield, but indirectly by listening to just from listening to the stories that these veterans had gone through. He recognized that he was impacted. And so for those of us who work in healthcare, we work in a system that has kind of raised its hand in the community and said, we're here for all, and we want to be a place of healing. We want to be a place of hope. We want to be a place of health. Well, if you're an entity that raises your hand and says this is why we're here, then we're going to get people that come into our institutions and into our settings who are hurting. We're going to get people who are suffering. Our chaplains often see people on the very worst day of their life. And there's a cost to that. There's a cost to caring. That's one way to think about compassion fatigue. I think one of the quote unquote more formal definitions would be it's the emotional residue or strain of exposure to working with those suffering from the consequences of traumatic events. And so what I like to remind teammates of is if you find yourself experiencing some of the symptoms and signs of compassion fatigue, which can include things like feeling numb about work that maybe used to bring you a lot of passion, and now you feel a little bit numb about it. You don't seem to have the same level of care that you used to, or you have disturbances in your sleep, or you have these images that you are exposed to on a day-to-day basis. You have a hard time letting go of those. You might notice differences in the way that differences in your diet, maybe a disinterest in things that used to interest you before. So I tell teammates that if you start noticing these symptoms, it doesn't mean something's wrong with you. It means you're human. Because if you're going to put yourself in a situation where you're going to be working with people who are really hurting and you care, then you're going to be impacted. So I even say to people who have been in this kind of work for decades, especially if they've been on what we kind of call quote unquote the front lines, you're going to experience some level of that if you continue to do it. And so how do we mitigate the impact of that? How do we help teammates kind of recognize, again, what the signs and symptoms are and how to deal with that? And but more than anything, really approach that from a perspective of, there's nothing wrong with you. It means that you're human, and this is a natural response to events that are really, really hard for people to kind of take in.
Their cup is empty. I'm sorry, Seth. Their cup. They find their cup empty, and
That's
we have
right.
to find a way to fill it.
And it not as beautifully stated as you did, Greg, but I could almost say that it's almost the simple saying is I'm giving so much of myself to others that sometimes I'm not recharged. I'm giving it all away. And
Right.
you've got some really good tips here and some perspective on, hey, there's nothing wrong with you. This is, we're all human. And I think that's it's just an extremely important perspective across the realms of well-being and health and well-being. But more importantly, just as you think about yourself, we're all human. And so giving yourself some grace and recognizing the signs, the symptoms, some of the things that might be leading to your current state, whether positive or negative, and given that perspective that you provided, I think it's an extremely, extremely valuable perspective.
Yeah, you mentioned something there, Seth, and kind of referring to the whole person. And I like to remind teammates that, you bring your whole self to work. And yes, of course, we talk about healthy ways to kind of bracket and so that we can do the job that we need to do and we can be fully present for the person who's right in front of us. And we bring our whole selves to work. So how can not just Atrium Health Code Lavender, but really all of Atrium Health, how can we recognize the whole person who is the teammate? And this is just one way to do that, is to recognize that when you're in these situations where you're a helper to someone who's suffering, this is part of what it means to be a whole person, that there'll be some level of suffering for you to kind of recognize and attend to as well.
So we've discussed the compassion fatigue. We've discussed what we do here at Atrium. So if a teammate were to call a code Lavender, walk us through that process. I know when we call a code blue, there's like a button and a code goes overhead and everybody knows about it. How does the code Lavender work exactly? How would a teammate tap into that, and what could they expect?
Yeah, great question. And so again, I'll just start by saying that Code Lavender involves various aspects, and it can look very different depending on the work site and depending on if it's a response to an event, depending on the event itself. But for teammates who are in inpatient facilities where there is a chaplain dedicated to that facility, the most easy way to call a code Lavender is just to contact the chaplain for that facility, and then they will take some information from the teammate and figure out kind of together with the teammate what is the best approach. But of course, not all of our teammates are in inpatient facilities. In fact, most of our teammates are not strictly in inpatient facilities, I'm guessing. And so for those teammates, we have developed what we call the Atrium Health Code Lavender Hope Line. And that's a number that teammates can call. The beautiful thing about it is it's 24 hours, 7 days a week. And teammates can call that either to ask for help for themselves. Maybe they're experiencing some emotional or psychological distress and they need a little bit of support, so they can call for themselves. Or if something's happened in their workspace to their teammates, it's on a unit. And I can give a couple of examples. For example, if let's say at an office practice, if they've had a situation where a patient who came in maybe for just a routine physical and had a crisis event and maybe had a code, and that office had to work with that code, that's not something that those teammates at that office are used to. It's not something that typically happens. And so they might be shaken up from that and need a little extra support. So the manager could call that Hope line, and that's 980-212-HOPE. It's easy to remember. They can call that Hope line and they can say, hey, we've we've had this thing happen and we could really use some support. And at that point, the Hope Line responder will, again, take the information, kind of assess, and in talking with the caller, figure out what's the best approach, and then go from there. And that approach will be event specific. So different teams and different teammates need different things. If it's an individual teammate need, a lot of times all they need is just someone to listen and to kind of hear them and maybe offer some resources. Oftentimes it's things that we're already aware of, but we just need reminding that, hey, there's EAP that's here. Hey, there are these events that LiveWell has scheduled that might be of use to you and of help to you. But sometimes teammates just need reminding. But a lot of times all they need is a listening ear. And if it's a unit, if it's a team that needs some support, then that's going to depend on, again, the nature of the event. They might need a debriefing. They might need a time to kind of gather and sort of talk through what happened. A lot of times what we do is, in some of that, is we're also educating teammates on some of the signs and symptoms of things like compassion fatigue and moral injury and burnout. But it can look very different. And then we're calling on the resources that are already in the system that have been there for in some cases for quite some time, and bringing those resources to bear to meet the need.
And Greg, you're doing exactly what I think is, set forth in Atrium's mission, and being able to provide that for our teammates as well. You talked about building, not just compassion, but a culture of compassion. The services that you've built on with the Hope Line for the code Lavender, I think, speak to that. But you also are, kind of part of a group, the Compassion Champions, that are, out there doing this every day too. So, for our teammates that aren't very familiar with Compassion Champions, what are they, and kind of what's that network for?
Sure. And really, it's the large active network of Compassion Champions who really have helped build Code Lavender from the ground up. And so a Compassion Champion is really any teammate who commits to and practices, one of our mottos is self-care leads to best care. So any teammate who is willing to, first and foremost, pay attention to their own self-care needs while they're at work, and then is willing to kind of be a set of eyes and ears for the teammates that they work shoulder to shoulder with. And then many of our Compassion Champions are also looking at their work setting and thinking about, how can I make my work setting a little more compassionate? So it's got those three levels. It's self, it's looking out for teammate, and it's looking out for my workspace. There's no application process to be a Compassion Champion. There's no test you got to take to be a Compassion Champion. But it's really just anyone who has that mindset and that, I would say, heart set. And our Compassion Champions, again, they're all over the system. Some are in our inpatient facilities, some are in our outpatient facilities, some are in office spaces, and many of them are sort of coordinating and planning maybe monthly events for their teammates. We call those Lavender events or Lavender days, and they're planning events to kind of remind their teammates that you can't give your best to others unless you first kind of taken care of yourself. It's sort of like the analogy of putting on your oxygen mask first. If you're in a plane and the oxygen masks drop, what do they always tell you? They always tell you to put yours on first, because if you don't, you won't be able to get to anybody else. Mm-hmm. So it's sort of the same idea. Someone who's willing to help their teammates because they model that first and foremost for themselves. And so currently we have close to 40,000 Compassion Champions in our system. We've got a smaller group that's really active, many of whom will join a monthly Compassion Champions meeting that we have on Teams. It's always the second Tuesday of every month at 2 p.m. And that becomes a place where these Compassion Champions can share best practices. They can talk about some of the things that they're doing in their workspaces. And they can also hear updates about Code Lavender and what's some of the progress that's being made in Code Lavender throughout the system, and really becomes a place where they can kind of network together. And so if it were not for our Compassion Champions, one, Atrium Health Code Lavender, I don't think would be here. They really are the foundation to the success of Code Lavender, because it can't be, and thankfully it isn't, something that has come from the top down, so to speak, but it has really been a movement that has started at the local level. And it's because of our Compassion Champions that it's been as successful as it has been.
That's amazing. That's a lot of Compassion Champions. That's
is
just incredible.
Yeah, at one time back in the days pre-COVID, when teammates would actually go to a physical location for teammate orientation, David Carl has a piece of that where he talks about the spiritual principles of the tree of life. And if any of you have been in teammate orientation when he was giving that presentation, that's, if you remembered anything, that's probably the one you remember, because he's a wonderful presenter, adds a lot of humor, and gets the teammates involved in his presentation. And so for quite some time, he was, I like to kid him sometimes and say he was baptizing whole groups who would come through orientation as Compassion Champions. And that has changed somewhat now because of the way they do orientation with COVID restrictions. But we want to make it as easy as possible for teammates to be involved if they want to be involved. And I just can't say enough good things about those who are involved in that movement and very active, because it's contagious, thankfully.
Absolutely. He's a great speaker. He's very passionate and compelling. I mean, I remember when my orientation, I was like, yes, I'll do it. I'll do it.
Right.
Where do I sign up?
Right.
So 2 other questions. One, about, as the teammate, if the teammate talks with a Compassion Champion, calls a Code Lavender, or talks with a chaplain, any of those things, is this confidential? And, is there any kind of records that are kept, or can the teammate do that completely confidential? And then just sort of a follow-up, make sure we get directions on where teammates who might be interested in becoming a Compassion Champion can find the information to do so.
Absolutely, Jennifer, and great question. And yes, so going back to the Hope line for a minute, all of those calls are completely confidential. And the way those calls work is the teammate will call that call from the 980-212-HOPE number. If they dial that number, that call initially is routed to a call center that Atrium Health operates, and there are other calls that come into that call center, and the Mint Hill call center teammate will screen that call initially just to make sure that that person calling isn't an immediate danger to themselves or to someone else. So to make sure that there's not an acute psychiatric crisis that's going on. And if there is, that call will then be immediately routed to a Atrium Health behavioral health specialist who can then take the call. And so once that screening has been put in place, they will do what's called a warm handoff to one of our Hope Line responders, our Compassion Catalyst, and they don't have to give their name. If they don't even want to give their name, or if they want to give a pseudo name, that's fine. There have been a number of times when a teammate has just called and just wanted to talk. They weren't calling for their team or their unit. They were just calling from themselves. And so those calls are completely confidential. That works the same if one of our chaplains responds to an inpatient unit where a teammate's in distress. Just like we do with patients and families that we serve, we work under an oath of confidentiality. And so that is never an issue and never a question for teammates. And I feel like there was another part of your question that I didn't get to, Jennifer. So
how can teammates get involved if you've sparked some interest through this wonderful interview? How could a teammate go sign up to be a Compassion Champion and get involved?
Great. Yeah, great question. If they are interested in more information about Code Lavender or about becoming a Compassion Champion, there's a couple of different ways they can do that. They can email our administrative assistant that's here at CMC, and that's Renee Howard. It's renee.howard@atriumhealth.org. They can email her, and she can give them more information about Compassion Champions. If they want to get the link to our monthly Compassion Champions call, she can forward that to them. If teammates just want more information about Atrium Health Code Lavender in general, there's an Atrium Health Code Lavender website that you can access through People Connect. And I tell folks the best way to find it is just get on People Connect, and then in the search bar, just type in Atrium Health Code Lavender, and it'll pop right up. But we've got some additional links that are on that website. There are some short videos that will tell you in more detail about some of the various aspects of Code Lavender. And I would also say feel free to email me, particularly if they have questions about our Hope Line and becoming a Hope Line responder, or just really anything. If I've piqued their interest and they've got a question for me, they can always reach out to me as well. And I'm Gregory Hathaway in the system. I think there's one other Hathaway last I checked, but I'm the only Gregory Hathaway, so that's just the easiest way to reach me.
Well, that's very kind that you put your information out there as well. We thank you so much. This has really been phenomenal. I hope that our teammates are walking away with some really great needed information. Is there anything else you'd like to just kind of leave our teammates with that we didn't touch on here?
Well, and again, I'm really grateful, Jennifer and Seth, for the opportunity to talk about it. I do enjoy very much kind of sharing this information because I know how much it's needed. I'd say the one thing that we haven't touched on that I'd like to share with teammates every opportunity that I get is around this whole issue of self-care, because often, and maybe this has been your experience as well, when self-care comes up, the next feeling that follows is usually one of guilt. You know, like I haven't stuck to my diet, or I haven't stuck to my exercise regimen. And I've talked to countless teammates who have told me I don't have an extra 20 minutes a day to do the things that I need to do for self-care. And what I like to share with them is there are so many interventions that don't take any extra time. That if you can just drop a few of these into your day, into the flow of your day or week, over time, they will make a difference. And first and foremost is just self-compassion. So I will often ask the teammate, you know, if your best friend in the whole world makes a mistake on the job, how are you going to respond to them? And then ask yourself, if you make the same mistake, how do you talk to yourself? And most often those two responses are very different because we're really hard on ourselves. And so if people can learn just the art of relating to themselves differently, to give yourself compassion, if you do nothing but notice how you talk to yourself in stressful situations, just the noticing will begin to bring about a change. And then there are things like breath work. There are so many evidence-based breath work practices that don't take any extra time that people can do on the job. There's aromatherapy that can be used on the job. So there's a lot of little things that I like to share with teammates that they can do that don't take any extra time, that over time make a huge difference. And of course, we're not the only ones talking about that. I know at LiveWell, LiveWell's put out so many wonderful resources on their website, and many of those are the things I've talked about and mentioned. So I just want to encourage teammates that you don't have to. It's good to get that exercise in, but you don't have to necessarily find another 20 or 30 minutes to begin to improve your own approach to self-care. You can just learn to relate to yourself a little more kindly and drop in some of these practices, and that can make a huge difference.
I love that. Thanks for taking time to go into that. I agree. I think that's valuable information that our teammates need to hear. Thank you so much, Greg, for coming on and talking about self-care and Compassion Champions and Code Lavender. We have found this time to be very valuable. Thank you so much.
It's been my pleasure, Jennifer and Seth. Thank you both. And thanks for the work that you all are doing. And really grateful to spend some moments with you here this morning.
Greg has such a passion for our teammates and their mental health space.
Jen, I hope I'm not alone here, but I was touched. I'm touched by the things that are going on across this system and the resources that are available right now. So that was a very deep conversation. There was a lot to digest for teammates. A lot for us to digest, just trying to have that conversation with Greg. What exactly did we learn today, Jen?
Well, first of all, Seth, we learned that Atrium Health takes the care of our teammates' mental health very seriously. Greg talked about compassion fatigue, which is when a care provider feels taxed emotionally by the act of caring for people. And this is something that can occur over time and that the caregiver really needs to be aware of and look for certain signs and symptoms. We learned that teammates can call a Code Lavender whenever they feel they're in need of some extra compassion or assistance with dealing with a difficult situation. Our Compassion Champions, these are teammates who volunteer to give back to other teammates who are in need. Lastly, I want to make sure that teammates know that talking to a chaplain or a Compassion Champion is completely confidential and safe. If we have teammates out there who have listened to our show today and feel called to be one of those Compassion Champions, please reach out to Greg Hathaway, or you can check out the Compassion Champions link on the People Connect page.
That's right. That's such a great group, making such a large impact across the system in this space. So feel free to follow up the Compassion Champions page. Also, teammates, there are resources available through LiveWell, focusing on your overall health and well-being. Also, the resilience page. So if you're looking for additional resources to working with a health coach, working with EAP, or if you just want some additional resources just to be more physically active, check out the LiveWell site. We've got a lot of great information that's been added.
And more than anything, just provide each other grace. Look at your teammates and make sure everyone is doing all right. If they're not, teammates feel free to step in, call that Code Lavender, or call over your Compassion Champion just to help each other out. In June, we're going to be changing our focus to family health and fitness. Our next podcast will be airing on June 3rd, and on that show, we'll be discussing migraines and headaches, and we're going to have a special guest from the migraine clinic.
That's right. Looking forward to June, but teammates, don't forget to visit the LiveWell website for more info on managing stress, working with the LiveWell health coach, and potentially more information on working through some of these mental health resources.
Our resources are listed at the end of the show, and we'll add links to the programs discussed today in the comments on our Streams channel.
Looking for more things Live Well? Not following our Streams channel yet? Search The Well on Streams in Office 365 or find us on the Live Well website to access all our content.
Thanks for listening to The Well today.
Stay safe
and live well.